All right, lower back pain can be so frustrating. It can happen for so many different reasons, but maybe you've trying things on your own. You've been watching videos, doing exercises. You've seen a chiropractor, you've seen a massage therapist, you've tried different things, but your back pain is not getting better. I'm going to talk about 4 hidden secrets of what you may have not tried that you need to try. When watching this video, we love to get feedback and comments, so let us know which top tip of these 4 that I'm going to talk about today that maybe is a surprise to you or you're going to go ahead and try. So if you've been dealing with back pain for 10 days or more, it's maybe been months, maybe been years, and you've just been looking at your lower back, addressing things from your lower back, but you really haven't solved the whole puzzle of your spine's connected to your hips, and you have to look at the big picture. So keep watching this video. I'm going to show you these top 4 secrets of why it's not getting better. Now, we have your spine here. I just want to show you what I'm talking about. This is the back part of your spine. You have these little bones, these prickly bones that stick out from your spine. In the back here, your spinous processes, and you have your hips all the way down here with your pelvis. So this is your sacrum, the lower part's fused together. And then you have your lumbar area, your thoracic spine. It's made up of joints that like to do a lot of rotation. And then your cervical spine, or where your neck is here. So I like to show you how your lower back, see how it's connected to your thoracic spine and to your pelvis and your hips. So you have to look above and below those joints, and this is what I address as a back pain specialist and physical therapist with all my clients, is really looking at the big picture and how those are working together. And sometimes that could be the missing piece for you. So if this sounds like you've been struggling for a while, and number one thing, if you have not done, is see an expert physical therapist that specializes in back pain. Now, injections, surgery, medications, if that doesn't sound like you and you want to get better in a more holistic manner and learn the proper things for your body to help it, then that would be the first tip that I would give you today is go to Google, search back pain specialist, physical therapist, someone in your area that you're gonna mesh well with. They're gonna do a mixture of hands-on work, release the muscles, release the joints, and they're also gonna give you exercises that are perfect for you to do at home and also kind of coach you along and guide you there. They're not just gonna give you a sheet of exercises, but they're really gonna put their hands on you, and they're also gonna coach you through what to do for your back pain. So that is the top tip. Number 2 would be addressing the thoracic spine. So this upper part of your back, this is in between your shoulder blades. It can be really stiff and tight. And for many people, they have back pain because of posture stress, because of repetitive activity, lifting something heavy. Maybe they were in a car accident. But the upper back, if that is really stiff, you're gonna put extra stress on your lower back. So I'm going to show you how you can actually assess this on yourself and check and see if this could be the issue. So if you sit in a chair and you have your knees together, your feet flat on the floor, my hips are facing forward, I'm going to place my hands over my chest here, crossed here, and I'm going to rotate my spine to the right, and then I'm going to rotate my spine to the left. And I may notice I have more rotation one way or the other, but that's going to isolate the upper part of your back. If you can't get at least 50 degrees on each side, which is normal, you may have an issue with your core not being strong enough because that's actively doing it, or your upper back may be really stiff and we need to work on the mobility. So that's the first way, how I check, but you can also do something that can turn into a mobility exercise if you truly have a lot of stiffness there. So I like to give this exercise because we do a lot of Pilates-based exercises and teach people Pilates mat exercises that they can do on their own. This one's called an open book exercise. It's a mat Pilates exercise. So I have a pillow between my knees are stacked. My hip's gonna be in line with my shoulders, and I have my hands straight out in front of me like an alligator opening its mouth. So I'm going to lift that top arm, and I'm going to rotate while I squeeze the pillow with my knees and if you can't get that shoulder all the way back, your shoulder blade against the mat, against the floor, wherever you're doing this stretch, and you're not rotating through your ribs, that could mean you have a lot of stiffness in your thoracic spine, the upper part of your back. So this is a great stretch to do. You also want to make sure that you keep your hand in line with your shoulder. So if you just feel it in your pecs and in your shoulder when you're stretching, that means you're trying to compensate for the fact you don't have rotation in your upper back. So do this with your breathing about 10 times on each side. But I take an inhale first, and as I exhale, I lift the top arm and I rotate, and I can see my hand here. It's in line with my shoulder, and I'm gonna do that with my breathing about 10 times on one side, 10 times on the other. But this is a great exercise. If this does hurt your lower back, you definitely wanna go in a more limited range of motion, or once again, speak to an expert of why that might be painful. But if you can't do that and that shoulder blade doesn't get down, that means you need more mobility in your thoracic spine. Now, because the lower back is more about stability, we talked about mobility here, stability here, we're gonna discuss how, number 3, if you're not working on core exercises or really working on the deep muscles that protect your spine like a corset, we're talking about your transverse abdominis, your multifidus muscles, your muscles that are more like stabilizers. They're endurance muscles. They get fatigued, they get tired when you're sitting or standing for a long period of time. And if you're having a lot of back pain, those muscles can shut off and stop working. So you have to get your brain to train them again. Now, I have a great video about some basic core exercises that you can start doing if you're having some back pain. And it's something that many people don't realize. It's not just about planks or crunches when you do core work, but it's working on breathing and connecting that with the muscles in your lower abdominals, your deep layer of your core. And that exercise video that I have over on YouTube on this channel is called Core Foundation. So go look that up afterward, and you can work on some exercises that are going to incorporate those deeper core muscles and that deeper layer, because you want that corset, those muscles to do their job. And people that may have a lot of back pain and they put on a back brace, it's like that's what it's masking, and that's what it's trying to provide support and relief for you to do, when your muscles should really be doing the work too. So back pain shuts off those deeper core stabilizing muscles, so we have to get the brain to train them again with breathing and contraction and control of those muscles. So that would be the third one. If you're not working on some gentle core muscle exercises that don't include planks or crunches, I'm talking about the deeper layer, then you need to do that as well. The fourth thing that I'm going to mention is going back to mobility. So above was your thoracic spine, below is your hip joints. And one way that you can do an exercise and also check to see how your hip mobility is, if you can go on your back and you can place your ankle over your knee and cross your knee, you should be able to line up that knee with the ankle. If your knee is like way up here toward your chest, or you can't even get that ankle over your knee and get in this position, you have some really stiff, tight hips. It could be the muscles, it could be the joint, but here's an exercise that you can start doing. And if you can't even get here, then you can start with just some gentle movements of getting your knees to kind of drop out to the side. You can do a butterfly stretch here. You can work toward getting your ankle over your knee and just doing some gentle presses of pushing that knee away from you. Now, you may still have tight hips if you can get in this position, but you want to really stretch the muscles that are deeper, even the muscles that can cause sciatic nerve related pain, because those can stiffen up and compress on the sciatic nerve in your hip. So I love this figure 4 stretch. You bring your hands around your thigh and you pull that leg towards you. Now, this may take a while to get there if you have really tight hips, but that tells you too, if you can't get in this position and you can't do this, you definitely have a hip issue. that you need to work on mobility of your hips and stretching your hips. And a physical therapist can teach you this kind of stuff too, how to safely open up your hips and work on some safe exercises that will really take the stress off of your lower back. When you have that stiffness below and above the lower back is going to compensate, and it's going to start showing up with more movement than it really needs. So those are 4 top tips. See a physical therapist that specializes in back pain if it's been 10 days or more and it's not getting better. Also work on mobility of your thoracic spine, your hips, and then core strength of your lower abdominals, deeper layer of your core, and that whole system, how it works together with your breathing as well, because your diaphragm is part of that. So those are 4 hidden secrets that you might not be adding into your program or addressing when you're dealing with back pain if it's just not getting better. So which one was a surprise to you? Which one have you not tried? Comment below and let me know. Love to hear feedback. And also, if you're not following this channel, please hit the subscribe button. Level 4 Women's Health, we give lots of top tips about Pilates exercises, back pain, sciatica relief tips, and more women's health topics to keep you feeling amazing. So subscribe to our channel, and thanks for watching.